My name is Errol Ozdalga. I'm the Associate Chair of Communications for the Stanford Department of Medicine, and I'm here with our chair, Dr. Robert Harrington. I'd like to start by just saying a little bit of why we're doing this interview today. When we first heard that Bob was leaving us for Cornell, it came pretty clear. Actually, it was Abraham Verghese's idea that we wanted to learn more about you. And maybe this interview is a long time coming. I got to say, I've been wanting to have this type of interview with you and ask questions like this for a long time. So I'm excited for this today. So Bob, thanks for being with us.
Thanks for having me. And I don't know if I should be excited or worried, but maybe, at the end of the conversation, we can reflect back and say which one it turned out to be. So no, I'm delighted we're getting to do this. I think it will be fun in some ways to say goodbye to a lot of people, but also to let people know that, as I've said on a few occasions, I'm not falling off the planet. Just give me a call. I'll be at Weill Cornell.
I'd like to, this is the beginning of what will be an ongoing conversation, just in a different capacity.
Exactly.
And we'll talk more about that. I wanted to share with you, one thing, anytime I meet with the residents before I go off service, I always sit down with them. We check in with them like as we do.
Yeah.
And one of the things I've said for years is that success comes from not necessarily how smart you are. We have tons of smart people here who have done amazing stuff, but it's more about, particularly for leaders, the type of person you are. And I always mention your name. I always end up, and I have for years. The type of person you are is this quality that is so unique, and as I believe is led to you being such an amazing leader, and it's being so impactful that you're leaving us. I wanted to learn more about what drives you, who you are today.
Yeah.
And if you don't mind, I wanted to just jump into even just a personal question. I know you have this amazing personal history. You've been through so many challenges, and I wanted to learn more about how that has perhaps made who you are today. If you mind sharing a little bit about your history and really the beginnings of your career in school and your personal life, if you don't mind.
So we're going to really get into it.
Yes, right into it.
Well, first off, thanks for doing this. It's been a privilege to be here, as you know, and this is an amazing place, and I've enjoyed every moment of being here. So I grew up in Boston, as with the background you'll probably pick out quickly with my various Red Sox paraphernalia, et cetera. I grew up in Boston. Was my mom and my sister and myself. So I was raised by a single mother. My sister and I and my mother, we lived next door to her parents. And next door to that was my mother's sister. So jokingly say that while I lived in, the inner city Boston, I had like the Kennedy compound. We had all three houses in a line there. And it was a typical, as you would say in those days, Irish, Italian, Catholic neighborhood. Everybody knew each other. We ate dinner, my sister and I, at my grandmother's house most days because my mother was working. And we just went back and forth seamlessly in the neighborhood in between the houses. You look back and you say, oh, it was a rough, tough neighborhood that you grew up in. And yeah, it probably was. But I grew up in the neighborhood, so I never really realized that. Went to Catholic schools from there because my mother was very insistent that I get a great education and a safe education, and my sister the same way. And I graduated from Arlington Catholic High School, so the next town over, and then went off the whole long distance of about 45 miles away, which I thought I was really going far away, to College of the Holy Cross, and that really becomes the formative part of my young life, is to go off to Holy Cross. I was a classic sort of Catholic kid coming out of Boston, where these are the schools I applied to coming out of high school: Holy Cross, Boston College, Villanova, Georgetown, Notre Dame, and UMass, because that's what the nuns told us to apply to. So it was interesting. My grandmother, who people have heard me talk about, was a maid at Harvard College. She cleaned the dorms, and but I never applied to Harvard, even though I lived, 2 miles from there.
That's amazing. Bob, there was this time that you and I were going to a baseball game. This was years ago.
We've done that a few times.
We've done it a few times. It's some of my favorite memories. But I remember a question I asked you on the train. I asked you, Bob, what was your favorite time in your professional or personal career? Really, what's your favorite age so far that you've had?
In my professional career? What did I say to you?
You told me your early 40s with the family and the kids, and it's a time you remember the most.
I was thinking it's not the very early part of your career, because it's almost in some ways you don't remember a lot of it because everything's moving so fast. I mean, being an interventional cardiology fellow at Duke was a daunting task. Working for Rob Califf in the early days of the Duke Data Bank was a daunting task. 40s, I felt like I kind of knew what I was doing. I had a sense of who I was. The clinical practice was something that I had an established role as both. I had a very different clinical role at Duke than I do here. Here I'm a general cardiologist. There I was a cardiac intensivist, a cath lab guy, interventional cardiologist, and I was a researcher. And so I was able to balance all the things. I moved here and I'm not in the cath lab. I'm not in the CCU. I'm a general cardiologist. I'm in the clinic. I'm on the wards, which is very different. But I would think that my 40s was fun. Having been a young interventionalist, still able to do cases all night and still able to take care of people in a busy CCU. And the research at the Duke Clinical Research Institute was going really well.
You've talked about before, and this may have been even early in your career, at the beginning of your career, you made a lot of sacrifices. Interventional cardiologists, especially early on, weren't necessarily having stents. Yeah. You were in the lab for hours, and there was a lot of personal toll throughout your life. One of the things that resonates with a lot of us is that you focused a lot on personal growth throughout your career. You have a personal coach, which we've all benefited from, Rebecca Merrill, who's amazing. One of the things I wanted to learn, and one of the things I've learned is that people who are so successful aren't by surprise. It's intentional as well. I'm sure there's a lot of qualities that you were born with, but there's also many that you developed intentionally. When did you start putting that attention into your personal growth? When you've been with Rebecca, she's been your coach for so many years.
Oh, goodness, yeah. Like she's been my coach for 15, 16 years.
How did that happen? And have you always been interested in personal growth, or did it start with Rebecca?
So a series of great questions in that. Yeah, I mean, I think that I always tell people who are looking at leadership roles that maybe a few leaders are born. Most leaders are made. And like anything else, I like your word choice. I use it when people say, what's your leadership style? One of the words I always use is intentional. Mm-hmm. You want to be intentional about things. And the story with the executive coach is that I had taken over from Rob Califf as the director of the Duke Clinical Research Institute. Now, when I took it over, it was a big enterprise. When I left, it was even larger. But when I took it over, it was about 800 employees. That's a large organization. I'd never run anything with 800 employees, and I certainly had never had a COO, a CFO, a chief business development officer, et cetera, all reporting to me. Why did I get appointed as the director of the DCRI? Well, because I was a really good clinical scientist. It was not because I was a management expert. Mm-hmm. And as I got into the role, I realized I was like really comfortable with the science and really comfortable mentoring faculty and fellows and thinking about research projects, running research projects. But what I was less comfortable with is the role of being the executive of these really high functioning professionals who were not scientists. They were business professionals, like I said, CFO, COO, et cetera. So I remember having a conversation with the chief of human resources at the time, Mark Rumbles, and I said, Mark, I feel really inadequate. I've been in the DCRI role for about 6-9 months. I don't know, like, how do I lead these people? They're different than leading clinicians and scientists. I said, do I need to go back to school and take some courses? Do I need to get an MBA? I mean, what do I do? And he just asked me, he said, have you ever heard of the concept of an executive coach? And I hadn't. I did he gave me some things to read about it. And then I said, well, that might work. Somebody who could really help me develop my leadership and executive management skills. And so then I went through a series of talking to different coaches, interviewed different coaches. And Rebecca and I thought that we would be a good match. She had never coached any. She was a business executive coach. She'd never coached anyone in academic medicine, but she thought I would be a good first try. And so but then I made a big commitment. And this is where your comment, Errol, I think intentionality is spot on. For the first year and a half, maybe even 2 years, I met with her every week, unless I was out of town or something. And I met with her for about an hour and a half, 2 hours every week. It was a huge commitment to really have her understand my world, me to begin to understand the world of leadership and leading executives. And I worked with her regularly through my time at Duke. I've worked with her regularly here. Now I meet with her a little less frequently. than I used to, but I still meet with her on the range of every other month, every quarter, and certainly on an ad hoc basis. And she runs a large number of programs for the department, et cetera. I think she's been good for the department in terms of helping teach leadership skills to a variety of people. And she certainly has been really helpful in my career development.
I can tell you a lot of us, I joined that group in part because we learned she was your coach and we wanted to be as much like you as possible. The whole group said something similar when I first did this. So it's been very helpful. Absolutely.
Good.
You talked a lot about new roles and responsibilities through the DCRI, the Duke Clinical Research Institute, and then, of course, coming here as the chair. One of the things I've observed is that it seems that in academia and probably in other areas, as you get higher and more promoted, more senior, you actually have more responsibility. You may be more busy or maybe more stressed. There's not less as you progress. And that surprised me as I became a more senior. How do you attack that? What advice do you have to people that could be daunting? I think some people maybe not take more responsibility because they realize there's more responsibility with it. Yeah. What's your advice to people as they become more senior in this field?
Well, what I always give people advice on, and what I think about in my own brain is you have to try to understand who you are. This is where something like an executive coach can help you, is to really understand what's your personality makeup, or, to use the clinical/scientific phrase, what's your phenotype? I mean, who are you, and where do you gain pleasure? Many of us that move into these roles did so because we were terrific clinicians, or we were terrific scientists, or we were great educators, or we had some mixture of that. Mine was that I was a really busy clinical scientist, and a really busy clinician. And at Duke, I was able to really put those together and forge a career. What I always tell people is that if you're looking at that next opportunity, you should think about it as, is it going to extend you, or is it going to deepen you? Mm-hmm. If you're going to be the same, the so-called lateral move, mm-hmm. and you're happy where you are, do not move. You should really be thinking about, will it extend your skill set, or will it deepen your skill set? And I think either one is a great reason to move. And people, as their careers develop, seem to either extend their scope of activities or deepen their knowledge about their content area. The example I often give is that two leaders when I was at Duke, Rob Califf and Bob Lefkowitz, Bob's a little older than Rob, but not that much. And so I think of them as more contemporaries. Rob, at some point, made the decision to move from being a clinical scientist to broader and broader and broader. Today, he's the FDA commissioner for a second time. Certainly success by any measure, but he went broader. He broadened his skill set. Mm-hmm. Bob Lefkowitz, scientist, went deeper, deeper, deeper. Never wanted to be a division chief, never wanted to be a department chair, a dean, wanted to do science. Well, he ends up winning the Nobel Prize, along with Brian Kabilka, one of his former postdocs when Brian was at Duke. Both hugely successful. They just did it differently. And I give people that piece of advice all the time. You should go broader or you should go deeper. And then as you do that, you definitely have to make, this gets to the intentionality, you got to make decisions. Like when I came here, I'm not in the cath lab. I'm not in the intensive care unit because the time constraints of that was such that I don't think I can do that with being the chair. So you have to pick and choose and understand what you're going to be. But you also should be thinking, don't give up all the things that make you happy. So as you know, I've stayed busy clinically. I've stayed busy doing research. I've kept my identity as a cardiologist. Mm-hmm. And I intend to do all of that in my next role, though with less of each one. I'm not going to be as busy clinically, but I will be clinically active. I'll still do some research, and I'll maintain my identity as a cardiologist. It
was great to see. I know you had clinic regularly, and then you also attended on the wards despite being a chair here.
It's everybody in the office suite knows that when I walk out the door to my clinic's over in the Portola Valley Cardiology Clinic. When I walk out the door to drive over there, I usually have the biggest smile on my face. Everybody knows I'm going to go spend the afternoon or the day, whatever it is, seeing patients, and I could not be happier. I mean, that's why you and I went to medical school, is to be doctors. Absolutely. And so I always want to do that. And I intend, like I said, when I go to Weill Cornell, I intend to also see patients.
You had all these opportunities. Clearly, you've had many opportunities throughout your trajectory so far, DCRI, then Stanford, now into Cornell. Probably could have gone to pharma. You probably could have done leadership in other areas. How did you choose the path? How did you decide what you decided? And do you regret any decisions, or is there any advice along the lines that for other people who will be deciding between what path to take that you can share?
It's a great question. One of the things I often will say is that, like, if you just talk to me like you are now, you go, wow, that's just been this linear progression from having been, at Duke to come to Stanford to go to Weill Cornell. But when you unpack it, it's not quite so linear. There's, twists and turns here and there. What I always try to convey to people is that it's unusual. When you get into the details, careers are not usually linear. There's fits and starts. Things worked, things didn't work. You were happier doing one thing than another. So take that as the first thing. Like, it doesn't have to be linear. The second thing is ask yourself a lot of questions about what you like and what you enjoy. Like, I have certain things. Like, if you told me, well, you're not going to be a doctor, practicing doctor, you're not going to be able to do any research, I'd say, well, that's not a very good opportunity. In fact, it was funny. I remember when we were being recruited for this job by Dean Pizzo at the time. We were at dinner. It was Dr. Dean Pizzo, Rhonda, my wife, and myself. And he looked at Rhonda and he said, "You're not convinced that this is a good job." And Rhonda, she wears her feelings on her sleeve. You know what she's thinking. And she looked at him and she said, "Well, I can't see my husband not doing research." And he looked at her and he said, "Well, why would you think he would have to stop?" Him saying that was hugely important to the decision making for she and I. Just that simple statement. He said, at Stanford, we want our chairs to do what it is that they love to do. If you're a surgeon, operate. If you're a researcher, do some science. He said, "Now, I'll be honest with you, you're going to probably do less than you do here, but don't give it up. You've worked too hard to get those skills, and that's what gives you great joy." And so that's my advice, is to don't think you have to give stuff up, but think about how you contain it in a way. And so one of the, it gets back to that intentionality. It gets back to understanding your phenotype and what makes you happy. You've heard me say this. I talk about things that I decide to do based on a formula, given that I'm a nerdy math guy. I cubed over capital left. It should be interesting, innovative, potentially impactful, but most of all, it's got to be fun. And for me, fun is like the people. Fun is the topic. Like, solving a problem to me in cardiovascular medicine is like, that's fun. Going to meetings and planning projects with interesting, fun people, that's fun.
You mentioned Dean Pizzo when you came here. You've also mentioned in the past that he, almost as if he took a chance on you. You made this, which I find that hard to believe, but you were running a hugely successful research institute, but you mentioned that you weren't a chair before, you weren't a division chief before you came into this chair role. Is that any sort of people who not necessarily people who are striving to necessarily be just a department chair, but to be leaders in academia or even in general, whatever their goal is? How did you mindset to get to the positions you are? Were you thinking about it years in advance? Were you strategizing? Were you just having fun where you were and the next step came? How did that process work for you? What advice would you have for others?
So a big piece of advice I would have is that earlier comment, know yourself and what makes you happy and what you're interested in. Leaders can come from really a variety of backgrounds. There's this traditional notion, you want to be, you want to be a dean. Well, you should be a clinical leader and you should be a research leader, and then you should take over some sort of section or some sort of research center, and then maybe you're a department chair, and then maybe from there, as a department chair, you can, become a dean or other positions. I would say what Dean Pizzo did take a chance on me. I was a busy clinician at Duke. Most of my career, I did half research and half clinical medicine. Later, even when I was the DCRI director, I did about a third clinical work and about 2/3 research. I never ran the cath lab. I never ran the CCU. I was never the division of cardiology chief. I ran a research institute. Now, my research institute was very big budget to manage, but I never managed something clinical. And that's not usually how they pick department chairs. But I think what Dean Pizzo and the search committee recognized is that I had had a lot of leadership experience, including a lot of financial management experience. Because this was a big, I said when I started the DCRI as the director, it was about 800 faculty. 800 employees. When I left, it was about 1,300. So a lot of growth, big budget, and was able to understand how to manage that. But I had a lot of learning to do when I got here about like how the clinical enterprise, other than my section of it, worked. And there was a lot of learning to do. But that was what excited me, right? That was the broadening of my skill set, that I wanted to go more broadly. I could have stayed and gotten deeper and deeper into research, or I could have broadened my skill, learned how to run a clinical enterprise, et cetera. The other thing is that in terms of understanding yourself is that I never was looking for, I tell people the jobs kind of found me. I would have stayed at Duke forever and I would have been happy as can be if I hadn't gotten a phone call from the Stanford search committee that said, hey, we got something interesting. Same thing happened with this one, which is the search firm who I know well, called me and said, hey, got something interesting that's just come up.
That's a great segue to my next question. You talked about the experiences you had that led to that maybe aha moment with Rhonda asking that question that you knew this was a good fit for you. Is there anything you can share with us now about, I think a lot of us would love to hear more about the process that led to you accepting this new position at Cornell, probably to help us deal with the fact that you're leaving us. But I'd love to hear more about, was there an aha moment? What was going on? I know this came relatively
quickly, yeah. First contact was like early April, and announcement came last week in May, early June. It went very quickly, went very confidentially. And the marvels of Zoom and a lot of Zoom stuff, phone stuff, and then visit, not actually to campus. I never saw campus until this past weekend when Rhonda and I were in New York, and we went down and visited Weill Cornell campus. But yeah, this was one of these ones where somebody called me. And what this is, again, knowing yourself. I love this job. Again, if you said to me, Bob, you're going to stay in this job forever and then retire, I would have said, half my career at Duke, half my career at Stanford. How great is that? I would have been completely happy, and I would have felt like I had made a difference and contributed a little bit. But taking my own advice from what I tell other people, this was a real opportunity to stretch myself. So this is a different type of dean's job in that it's what I've termed and other people have termed Dean Plus. So in addition to overseeing the research and education, the entire clinical practice plan, not the running of the health system, but the practice plan for the faculty, reports up to the dean. Oh, and there's also a medical school in the Middle East that's been, thriving for about almost 25 years in Qatar. Oh, there's other international programs which are thriving. So big, broad role as the dean there. So really stretching myself. Then the other piece was that, I've been at two great universities, Duke and Stanford. I'm not sure I'd be as excited about something that's only medicine. I think that one of Stanford's great strengths, its secret sauce, if you will, is the ability to collaborate across schools, across disciplines. So the fact that this job also was tightly tied to Cornell University, a great university, albeit farther away than either Duke University was from Duke Medicine or Stanford University is from Stanford Medicine. So because of that, I also will serve as the provost of medical affairs for Cornell University and report directly to the president of the university. So bigger scope that'll help stretch me and hopefully help me gain another set of skills of leadership and really be able to be a person tightly tied to a great university and be really the interface between the medical campus and the rest of the campus, which has some amazing, schools.
Bob, you're not one thing I've noticed about you, you're not one to worry. You're not a kind of a fear-based driver. You're positive. I'm just curious this question, though. You're taking this whole new role, which I think for most people be very daunting. Are there any fears or any concerns you have as you move to the next role about yourself or the role itself? And I ask that question also to help others understand how you make such a big decision in your life.
Yeah, I'm scared to death. I mean, comfort would be staying here and doing a job that I think I've done pretty well. and that I could continue. And as you know well, because we always talk about it, tons of stuff to do here. Mm-hmm. In fact, I've told Dean Miner, I said, I'm happy to help you recruit the next person, because if they call me, I'll tell them this is a great chair's job with great people and with things that still have to be done. Mm-hmm. So I'm not like leaving and saying, oh, I finished what I wanted to finish. No, there was a ton of stuff I still wanted to do here. Maybe I worry more quietly than you observe, because I definitely worry, and I'm scared and I'm anxious. But I'm going to approach it in the same way that I approach most problem solving, which is, I'll listen a lot. I'll talk to a lot of people. As you know, I love looking at data. I'll gather a lot of data and information, and I'll figure out who is going to help me and put the team together, and we'll see what we can do. But yeah, no, don't, I don't want people to say, oh, he never worries about it. I worry all the time. Sure. But I also know that there's amazing people to help you. Mm-hmm. I mean, think about what you and I have done together in communications. Think about with Kathy Garzia. I mean, what Kathy and I do together.
It's amazing to hear that, because perhaps you worry, but you never let that worry fall on all of us. You always were despite the whole pandemic, always calm and cool and had a plan.
Well, I think that is part of what I've learned over the years. And I remember when I left DCRI, my successor, mm-hmm. He and I would have occasional calls where he would just run things by me. And not that he needed my advice, but that he was just looking for like somebody that had sat in the chair. Rob Califf had done the same for me, that I would say, hey, Rob, how does this work? And so he was asking me these questions and said, did you used to go to this meeting? Yeah. Did you do this? Yep. Well, what about, oh yeah, I did that every other week. He'd say, I didn't know any of that. I'd say, well, that's part of what a leader should do. The leader should, if you're getting your job done with as few as obstacles as possible, and you have no idea how I spend my time, I'm being a success, because I'm helping clear the field for you, but I'm not getting in your way. And you're just off running and doing your thing. And that's one of my things that I believe in leadership, is that leaders should clear the field of obstacles and let talented people do the things that they can do. And so I never want people to say, I have no idea what he does. Great. Are you getting your job done? Then I'm doing mine. Then, yeah.
During your time at Stanford, what legacy are you most proud of?
Oh, I'm looking at it. It's the people. When I came here, I was a small faculty, 240 or so. I've told the story. Now 700 or so, 100. Big staff, a lot of trainees. It's a different place than when we got here. So I'm proud of the people. I'm proud of the fact that we grew the clinical enterprise. As you know, before I arrived, this was a small hospital, a lot of community practitioners. I think a year or two before I got here, about 50% of the discharges were community physicians. Very different today, right? Now we're not Stanford Hospital, we're Stanford Healthcare. And that to me is something I'm really proud of, because we did that. We've grown east, we've grown south, we've grown on campus, Redwood City, but we've not sacrificed who we are, which is that we are an amazing science place. And our NIH rankings have continued to rise. We're now in the top 10 for departments of medicine. We were at 19 or 20 when I arrived. We've made huge investments into science, huge investments into education, huge investments into diversity, equity, inclusion, justice, and belonging. Mm-hmm. What I would say that I'm most proud of, Errol, is that I helped balance. Stanford was really research, clinical medicine. I would say now we're investing in both, and in the education. I would say that we're the three missions. And then remember, in the last couple of years, we introduced a fourth mission, which is community partnerships. So I'm really proud of the fact that we now have 4 missions in the Department of Medicine. And we've not sacrificed, I don't think, one at the expense of another.
As you leave Stanford, what will you miss the most?
The people. I mean, I love hanging out. I'm like the most fortunate person in the world. I got Abraham Verghese in the office next to me. And I never forget the first summer I was here. I came, my kids were home from college, and they said, Dad, how was your day? I said, I don't know, you tell me how my day was. I was in Abraham Verghese's office for a half hour, 45 minutes, talking about what books we were reading. Wow. And Abraham's just an example of like the hugely talented people. I mean, you and I talk baseball all summer long. Kathy talking to me all the time. Irina, my more than wonderful executive assistant. I mean, the people here are amazing, and I've enjoyed every moment of being here with the people. And the chairs. Once a month, the chair group has dinner. Mm-hmm. It's one of the best things at Stanford. And I love going to that dinner every month. There's 18 of us, and I would say on average 14 to 15 of us go. And it's a different 14 to 15. People don't want to miss it. It's a chance to, and I think it's one of the things that's really special about Stanford. It builds collegial relationships. I will miss that dinner a lot.
You mentioned earlier that if a prospective chair wants to chat with you, you'd be happy to, and you'd mentioned how there's so much to do. Of course, still, there's so much for us to do. If you could look back, and I'm sure you will be looking back on this as well, what would you like to see Stanford focus on? Where would you like us to be years from now? What would make you happy to see?
Well, I'll put the cautionary tale around that. Not my role to tell people what I'd like to see it be. That's for you and the next group. But I'm hopeful that we'll continue on the team science world, because I think team science here at Stanford can be as good as any place on the planet. I mean, amazing basic scientists, amazing clinicians, amazing clinical scientists. How do you put it all together in a way that you can tackle some really big questions and some really big problems? I would love to see that focus continue. We've made huge investments, as you know, into trying to create a more diverse community. We've made huge, the medical grand rounds piece that you've pioneered. I got comments when I was in New York recently about, tell us about your medical grand rounds series, because you seem to have captured people with that. And I said, hey, the credit goes to Errol. But think about what we did, Errol. You remember the first week where we started having the panel? And then we realized our Zoom license wasn't big enough. Yeah. We'd only had we could do 1,000 people, and we had 3,000 or 4,000 people. Yeah. Wow. I hope that one of the things that I've done, and maybe this video stuff gives an example of that, is that the communication piece too, is that helps create community. That helps people feel like they're part of the department. And I do think people feel part of a department here, and that the Department of Medicine is, I do think this is something special. And I hope that continues. I hope that the communications piece continues, and that commitment to sharing continues.
Bob, you've been this amazing leader, which I might add, in the 10 plus years I've worked with you, I've never seen you once lose your cool, despite a million reasons to do so, unbelievably. There's so many questions I could ask on this, but I want to, as we get close to the end here, just ask you, as an amazing leader, colleague, and friend, what message do you have for the Stanford community as you move on to the next phase? Well,
I'm going to comment first on losing my cool. Give Rebecca Merrill some credit for that one. Is that also teaches you that you're coachable. Because as a young interventional cath lab person, yes, I've lost my cool over times. But one of the things I've learned is that is rarely, maybe if ever, an effective leadership strategy, losing your cool. I'm more likely to close my door and shake my head rather than lose my cool. Because I think that when you lose your cool, maybe on occasion it's appropriate because the issue is so egregious that you need to deal with it. And it shows that you emotionally care about the issue. But I don't think it's a great leadership style. So what would I want people to leave with? I want people to leave with the notion that this is a great place. Stanford University, the Stanford medicine community is an amazing place. The relationships here of the school with the two health systems is amazing. When you go to meetings with health system people and school people, there's great collegiality. Okay, let's solve this. We all work for Stanford Medicine. And we all ultimately work for Stanford University. How do we solve this? And so don't lose that. Don't lose that sense of community, that sense of connectiveness, that sense of being part of something that's really great. Stanford Medicine within Stanford University. The second is to be true to yourselves, is that there's a great science place. Take advantage of that. Thirdly, the clinical opportunity. One of the things I'd tell the next person is, oh my goodness, yeah, we've grown the place. There's a lot of opportunity. You've heard me all the time, east, south, just amazing opportunities. The Science Research Park, if, this notion that this could be all along the streets of Page Mill Porter and up, and so if you thought about our campus, if you will, of the future, this sort of seamless transition from the VA campus to the Stanford Research Park campus to Stanford University campus to Stanford Medicine. Wow, that's a powerful image. Don't lose that sort of excitement about the vision. I think the future is usually bright here.
Last question.
Yeah.
Now you're moving closer to Boston and to Duke.
Yeah.
Are you going to get to more games, or is it going to be even harder to do so with your new responsibilities?
Well, what do you think? Of course I'm going to go to games. So that I'm going to, although this year the Red Sox are such a disappointment that I may not be traveling to Boston much. But yeah, it's an easy way. It's an easy drive to Boston. It's an easy train to Boston. I am looking forward to more Duke basketball games. As you know, I still do fly to Duke games. Not that many a year, several. But I'm sure that, as I said to Rhonda, we can decide on Saturday morning, do we want to go down to Duke and watch the game that night? That does appeal. I mean, I'm going to remain a huge sports fan, and that's not going to change. And I am still going to start my day reading the Boston Globe.
Well, as we said at the beginning, this isn't the end of our conversation. This is just a beginning of a new way, a new collaboration you've had with many colleagues throughout your career. Again, thank you on behalf of our community for everything you've done, and we're really looking forward to seeing you do more amazing things throughout your career.
Well, I'm going to be looking west with also that same vision of, I know that they're going to be doing great things. I'm going to be very proud to watch how you and the rest of the faculty and the staff and the trainees all continue to evolve your careers.
Thank you for spending time with us today.
Thanks for having me.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.